My name is John Hunkeler. I'm an ophthalmologist from Kansas City, and I've been in practice over 30 years. And I've had a continuing interest in cataract and refractive surgery and enjoy continuing to enhance the outcomes for my patients. I was fortunate that when I finished residency, I joined my late associate in practice, and he always seemed to be looking out for the next new thing. And I followed in his footsteps, and then he kind of got off doing other things. But I kept on that pace with whatever was going on with regard to cataract and refractive surgery, and stayed on top of that, trying to be at the cutting edge. I feel fortunate to have had the opportunity to be at the forefront of some of the laser procedures, some of the lens implant procedures, and newer cataract procedures, and it's been exciting, still is. I was invited by several people to listen to the story about NeuroVision and RevitalVision, and it became very fascinating, especially in the context of trying to enhance the visual outcome of our patients that have had cataract and multifocal or presbyopia correcting IOLs. It seemed like a response to a very specific need in some patients who are not matching up to what we had expected and what they had expected the visual outcome to be, and seeing the success that RevitalVision offered to patients that it seemed logical to try. I was very impressed with these patients that went through the RevitalVision program, to hear their reaction to the enhancement for their vision. I was pleasantly surprised and overwhelmed that they adapted to this and really did improve the quality of vision. I think so often as a procedure is performed, cataract procedure or refractive surgery procedure, that patients often think, oh, there's nothing to it. I've had this surgery, it's extremely precise, and all I have to do is take advantage of it. Or in fact, there is some period of adaptation. We call it in ophthalmology neuroadaptation, and that just is a clue that there's something going on neurologically which fits into what NeuroVision or RevitalVision is all about, that there's a human component to it that is the part of effort and gain. And without some effort, you may not get the gain and meet the expectations that you've had. I think it will become an integral part of the way we enhance the visual outcome for our patients, and strongly encourage them to participate in the program if they're not satisfied with the outcome in one piece, and if we're pretty sure they ought to be able to be less dependent on their spectacles or need for contact lens, we'd strongly encourage them to try this. They're going to be able to see better, and I think for refractive surgery patients, very often, that is corneal refractive surgery, want to be able to see better at distance. Usually near vision's not an issue. But for our cataract patients today, we can really pretty closely hit the visual outcome at distance, and the limitation in the vision with either multifocal lenses or with the accommodating lens implants to correct the near vision, and we tend to have a little miss in that area. And it's, I think, due to the fact that there's this neuroadaptation that I think goes on, that the brain has to learn how to use the vision again that was maybe available as a youngster, but now you want to move the clock back, and a part of that requires a patient effort to get the gain of the better visual acuity. I think the key element about RevitalVision is that it involves your commitment and spending the time to do this. It's non-invasive, there are no drugs involved. The surgical outcome is pretty well determined. The doctor says, you know, your eye looks great, I don't understand why you're not seeing as well, but if you use a little of your time, effort, and energy, that you should be able to enhance your outcome. And that's what it's all about. No drugs, no invasion, pretty straightforward. This is applying the mind to the purpose of seeing better. And I think it is the element of coming back to being able to improve your vision by your personal involvement after the surgery, and it's part of the, we know this from orthopedics and other surgical procedures, you have to go through a rehab program. This is kind of a rehab program, and it's just logical. It's worked with other body systems, and it sure makes sense that it works so effectively as it does, and at least in our initial experience with RevitalVision.